We're starting with the beginning, lab activity number 1, a lot of terminology from chapter 1, Introduction to Anatomy. And we begin here with directional terms. These are used to describe the locations of various body parts. You notice 2 known body parts and terms to now relate their position to one another. However, the terminology here is dependent upon what's known as the anatomical position. Our body is flexible and dynamic, and in order for the standardized language to make sense, we have to be looking at a body that's in the same position, the same reference point. And the anatomical position is seen like so. So we have this figure, we have a person standing upright. It's the standing position. You notice face forward, arms and legs fully extended, arms along the side of the torso, legs fully extended, feet flat on the ground. And it's only in this standing reference point now will the directional terms make sense. So you always assume as if the body is in that anatomical position when we use these terms. So to begin, we could pair these two together. The first one's already filled in. The word superior is truly the word for above. So something being in a higher level and in a standing upright position, our head is superior to the shoulders. The head is above the height of the shoulders. So the opposite of superior is inferior. This is the word for at a lower level. And we can see that here. So in the standing position, upright, our anatomical position, the scalp and our hair is the most superior portion of our body. And the opposite of that, inferior, means at a lower level, the soles of our feet, the most inferior portion of the body. So we could say that the shoulders are inferior to the head. The shoulders are at a lower level. We have now the terms cranial and caudal. These terms now can be used between the head, neck, and all the way down, of course, to the pelvic cavity. So it's essentially from head to tail, whereas superior and inferior could span the entire body, including the appendages. Cranial, of course, meaning towards the head at a higher level. And in this case, towards the position of our tailbone. That's the term caudal. And superior and inferior could be used throughout the entire body. And cranial and caudal will actually make a little more sense if we think about a quadruped, if we think about a dog. Here's my little sketch. We'll put a tail on there. So from cranial to caudal. But of course, humans are standing upright on 2 feet. It just has this access here. So from our head down to our tailbone. Next, we have the terms anterior and posterior. We'll just get rid of the writing here. Anterior meaning towards the front, and the opposite, posterior, towards the back. So with this in mind, we could say that our nose is anterior to our ear because it's closer towards the front. And the opposite of that, the ear is posterior to the nose because in this case, the ear is closer to the back side, the posterior side. And you could already see the alternate terms. Anterior and ventral both mean towards the front. Posterior and dorsal both mean towards the back. And these terms can be used interchangeably. We now have the paired terms proximal and distal. And for now, a good way to use them is with the extremities. It can be used along the length of many other structures, but the arms and legs are a good example for now. The term proximal truly means towards the origin, the beginning of something. And our appendages both originate, they develop at the point where they connect to the torso. So towards the origin, or truly in the case of our appendages, closer to the attachment of the torso. That's the proximal side. So now away from the origin, traveling along the length of some structure. Distal, you can think more distant. It's away from the point of origin. And in this case, the tips of our fingers would be the most distal portion. So to use this, we could say that our knee is proximal to the ankle because the knee has this closer proximity to the torso compared to the more distal ankle. The wrist is distal to the elbow, is further away from the origin. So that gets us through most of the terms here. And just scrolling along, we have the term lateral versus medial. And using this same diagram, the term medial means towards the midline, towards the center. And the opposite, towards the right or left, away from the center. That's the term lateral, away from the center. We could say that the ear is lateral to the nose. It's further away from the center, so the ear is lateral to the nose. The next terms we'll go ahead and cross out. You can just cross out and omit contralateral and ipsilateral. We'll ignore those for now. And we'll pick up here now with the terms. We can pair these together, superficial and deep. The term superficial means towards the surface. So our skin, our epidermis, that's the more superficial layer of our body. And the opposite of towards the surface, deep, means away from the surface. In order to see any deep structures, we have to do some dissection. We would have to dissect away our superficial skin to see and reveal the deeper underlying muscles. So towards the surface and away from the surface. And the last terms we have here, parietal and visceral. These terms here will pertain to a serous membrane. We brought this up in lecture. So these serous membranes, these fluid-producing membranes within the area of the ventral body cavity. And serous membranes come in two components. There's the visceral portion and the parietal portion. So of these two layers, looking at the first part of the word for now. So visceral versus parietal. The visceral portion of a serous membrane is the deeper portion, to use the term, and it's directly fused to some particular organ. And that's always the case for the visceral membrane. It's a part of the organ. It's attached to the surface of the organ. Whereas the parietal component of a serous membrane, it lines some particular body cavity. So here we see the space of the cavity, and bordering the cavity, that's the parietal portion of that serous membrane. But you do notice the two layers, parietal and visceral, it's one continuous structure. So next we're moving into a section about these anatomical landmarks. These are now the Greek and Latin-based terms for different parts of the body. So you notice here there is the adjective, the descriptive form, cephalic. There's the noun, cephalon. So it's truly either of these terms that we want to use. And then we have just the English term. Cephalic region, the cephalon, that's what we commonly call our head. However, it's the adjective or the noun form. That's what we're truly focused on learning. So we can see that here in this figure. And again, we'll do that first one together. You can notice that there's the term, again, in bold, cephalon, or in parentheses, cephalic region. But we see the bracket is pointing to, yeah, the entire head. So we could use this figure, and of course, sticking with the list of terms that are right here in the lab manual, and this will always be the case. You're only responsible for what's in the lab manual, not everything in the textbook. So always use this as a guide. And we'll go down this list and we'll point out these different body parts. So we've already started with the cephalic region, the cephalon, our entire head. Specifically on the cephalon, the more superior portion, the location of your brain, for example, that's the cranial cavity, the cranial region. The inferior portion, that's the facial region, facies. The area of the forehead, just as it states here, the term for that is frons, or frontal region. Oral is the term for the mouth. So the oral cavity, the oris, that's the area of the mouth. Bucca, that's the area of our cheek, is the bucca. Cervices, this is now the region of the neck, cervices. Acromial, that's now the region of the shoulder, the acromion. So in this case, we don't want to use that term. Acromial or acromion. Thoracis, the area of the chest. You can think of the location of the rib cage. It's that thoracic region. Specifically in the area of the thoracic region, the area of the breast. So we can highlight around here. That's the mammary region. And continuing on, we have now the area of the abdomen. So the abdominal region, and we'll highlight all of this area here as the abdominal region. The lower back, the inferior back, so here we are on the dorsal side. And this is the lumbar region. Our posterior, we're on the dorsal or posterior side of the body, and that's the location of the gluteus. The pelvic region, and we'll just remove some of the writing here. The pelvic region, so we're right across here, the area of the hips for the pelvic region. We see here right at the hip joint, that's the inguinal region. We'll highlight here. The next term, pubic, the pubis is a more specific area of the pelvis. It's a particular bone within the pelvic region. So we're looking just at this anterior, medial, front, and central portion of the pelvic region, more specifically is the pubic region. Axillary, the underarm. So the axilla, the region of the armpit. Brachium, this is now on the upper extremity between the shoulder and elbow. It's that region of the brachium. Antecubital specifically is the anterior, to use the word, or ventral side of the elbow is antecubitus. Whereas the dorsal side of the elbow, the posterior side of the elbow, that is the olecranon. Antebrachium is what we commonly call our forearm. So we could say the more inferior or distal portion here. Distal to the elbow, inferior to the elbow. Carpus, the area of the wrist, the location of the carpal bones. Pollex, this is the term for the thumb, specifically just the thumb. And the anterior side of the hand, that's the palmar region facing forward. That's its position in anatomical position. Palmar region faces ventrally. And again, let's remove some of the writing. We have in our lower extremity, of course, the largest bone in our body, and that's the term for this area, is the femoral region. Just inferior to the femur, we have now from the anterior side of the knee, the patellar region, and the dorsal side of the knee, popliteal region. So the term popliteus. The crus, this is now the inferior or distal segment of our lower extremity. From the knee to ankle, that's the crus. And now on the posterior side, the dorsal side, this is now the sura, the location of our large calf muscles. The term for the ankle, that's the tarsus. And specifically in the area of the tarsus, we have now the calcaneus. That's the posterior heel. Calcaneus. The term dorsal, again, is the general term for the back, and that's what we're seeing here. Plantar, specifically now, that's the sole of the foot. So the inferior most portion of our body. And our medial toe, our large medial toe, the term is hallux. So that takes us through the list here. So now moving on to planes of section. Whenever we're viewing an MRI, if we're dissecting, we're cutting in an appropriate plane, and we have the descriptions here. So we'll start out with a longitudinal plane. This is now a plane that runs the length of some specimen. And with the indentations, we see that there's now several subtypes within that group. So a longitudinal plane running the length of a specimen. So we'll start with a sagittal plane. And as stated, there's now two specific types of sagittal planes. A mid-sagittal plane versus a parasagittal plane. And we have a figure to help with this section. So we notice here we're seeing a sagittal plane. It's running, first of all, the length of the specimen, in this case, vertical, the length of the body. Specifically, this picture is showing a mid-sagittal plane because it's directly in the medial section of the body. So there can only be one possible mid-sagittal plane running directly down the medial portion of the body. Or if we use this figure as a guide, we could draw in a mid-sagittal plane here. And we'll switch colors. So now if we are just slightly lateral to the center, right or left, now we're drawing a parasagittal plane. So as long as it's off center, and there could be an infinite number of parasagittal planes, just depending on how thin they are. We now have the term either frontal or coronal. This is another longitudinal plane running the length of the body. The difference is a sagittal plane will divide into right and left components. A frontal plane will divide into anterior and posterior components. The next one here, transverse plane. Transverse, this now divides into superior and inferior portions. And a frontal plane can be done anywhere on the scale on the side of the body. Frontal plane could be very close to the anterior side, or it could be back towards the posterior segment. And the same for transverse planes. A horizontal plane can be done anywhere on the body. So now moving on to the section here. We've already covered the different types of planes and the sections that result. So a frontal section that would divide a person into anterior and posterior segments, as we said. Sagittal, of course, is that vertical segment divided into right and left halves. You notice here an alternate term for transverse. It goes across the width. It's a horizontal slice going across the width. And another term for that is cross section, going across the width of a specimen. And the last one here, oblique. That's what's been drawn in here. So if it's at an angle between, you notice here, 0 degrees, transverse, 90 degrees for sagittal, some angle in between, and that's the term oblique plane. And anytime you see the word oblique, that means it's running at some angle. Some slanted angle is oblique. Now we have the section on body cavities. So these are the spaces that contain various organs. And we'll start with the dorsal grouping, which has these two subdivisions. So to begin with the dorsal body cavities, they're composed of the superior cranial cavity and the inferior spinal or vertebral. You can use either name. And we'll start with the diagram here. So with the dorsal body cavity groupings, again, subdivided into cranial cavity, the location of the brain, superior portion of the skull, and inferior to that, the spinal cavity contained within the vertebrae within the spine, And the major organ in that space is the spinal cord. And another way to see it is like so. On this diagram, we have a figure of a torso, the brain located in the cranial cavity, the spinal cord passing down the spinal or vertebral cavity. And again, the collection of the two together is called the dorsal body cavity. So now, in the area of the torso, anterior to the spinal cavity, the remainder of the torso, this is all known as now the ventral body cavity. So it is the majority of the torso, the area anterior to the spinal cavity. And we'll continue here with the rest of this segment. So to begin, within the ventral body cavity, the majority of the torso, that torso that's anterior to the spinal cavity, we'll begin with the thoracic cavity. Thoracic cavity includes these smaller subdivisions that are highlighted. And all of this thoracic cavity is superior to the diaphragm muscle. And we'll use a diagram like so. So to start out, we're in the ventral body cavity, the torso excluding the spinal cavity. It's then divided into the more superior thoracic cavity, superior to the diaphragm. Within the thoracic cavity, the two lateral components, lateral meaning towards the sides, there's a right and left pleural cavity, and this is the exact location for the paired lungs. All of the area medial to the two pleural cavities, so towards the center, this entire area medial to the two lungs is known as mediastinum. And this is where our windpipe and esophagus travel down. And now, inside of the mediastinum, the inferior region of the mediastinum, there's now a more specific cavity, the location of the heart, and this is known as pericardial cavity. And if we work backwards, the pericardial cavity is inside of the mediastinum. The mediastinum and the paired pleural cavities make up the thoracic cavity. The thoracic cavity is the superior portion of the ventral body cavity. And we can see that here. So we'll start with the diaphragm and all of this area superior within the rib cage, within the chest, this thoracic cavity here in red. We can see the highlighting now for the two pleural cavities. And we'll go ahead and draw in our mediastinum, medial to the two pleural cavities. And now the inferior section of that, resting right on the diaphragm, that's the location of the pericardial cavity. So now we want to move inferior to the diaphragm, and we see that there's the entire abdominal pelvic cavity, which is further subdivided into the superior abdominal cavity. And once we reach the area of the pelvis, you notice down here, that is truly the border for the pelvic cavity, that enclosed space within the pelvis. So now moving along, we come back to serous membranes. We've already now described the terms for visceral and parietal. And we'll just quickly go back to that here at the beginning. Parietal and visceral. So again, those pertain to the serous membranes that are found in our ventral body cavities, specifically the pleural cavities, the pericardial cavity, and within the abdominal cavity, there's a more specific term, peritoneal cavity, and that's where the term peritoneal membranes come from. So we'll use this as a reference once more. Within the anterior portion of the abdominal cavity, there's what's known as a peritoneal cavity. And the anterior abdominal cavity, specifically the peritoneal cavity, has its own peritoneal membrane or peritoneum. So it's with these three locations, the pleural cavities for the lungs, the pericardial cavity for the heart, and in the abdomen, you could think of the stomach, the intestines, the liver. They're all in that peritoneal cavity and lined with the peritoneal membranes. So if we go through the 6 general serous membranes of the body, and we'll start here as a reference, the visceral pericardium, and ask what organ is it attached to? Well, visceral always implies the membrane is attached to some organ. Pericardium, the only organ in the pericardial cavity is the heart. So what organ does the visceral pericardium attach to? The visceral pericardium is the membrane that's attached to the surface of the heart. And we just saw that earlier here. So if we look at the full name, the visceral pericardium, this is the serous membrane attached right on to the surface of the heart. The term visceral implies that it's attached to some organ. Pericardium because of the location, because of the cavity that contains the heart. So the second layer of the membrane, the parietal pericardium, we see the parietal pericardium is lining, bordering the pericardial cavity. And that's the full name of now these serous membranes. The first part of the name is going to be either visceral parietal, depending does it touch the organ or does it line the wall of the cavity. And the second part of the name is based on the cavity itself. So with this in mind, we could go back to here. What cavity wall does this line? Well, we just saw it lines the wall of the pericardial cavity, the membrane known as parietal peritoneum. So we could apply this same concept here to the pleura, and the pleural cavities. Well, this is the location of the lung. So a visceral pleura, and we could try to draw this in. A visceral pleura would be attached directly onto the lung. So we'll try to draw that in blue. And then a parietal pleural membrane, just slightly offset. This would line the wall of the pleural cavity. So that would be the second layer of that membrane, kind of like so. And the same idea for the anterior abdominal region. So you want to think about your stomach and intestines. The membrane connected to those organs, that'd be the visceral peritoneum. And the membrane lining the wall of the cavity, that's the parietal peritoneum. And the purpose of any of these organs, these simple serous membranes, which are simple organs themselves, they produce a fluid, that's serous secretion, and these membranes protect these organs from friction. Just imagine you take a deep breath, you're enlarging and inflating your lungs, and these two moist membranes protecting the organ from friction as it expands and constricts. Moving along now to the abdominal pelvic regions, we have the names listed out here. And this is just simply now learning this grid right here. So we're able to see the superior abdominal region, the inferior pelvic region, and we just see these 9 areas. Of course, just right and left are going to be paired together. And just learning the different segments here on this grid. So this has all the terminology. And keep in mind, it's right and left as if you are the patient, as if you are the subject. So just simply learning the names, nothing more. The names of those different segments. And the final portion here about the singular and plural forms of a word. We only want to focus on the ones that were already brought up in lecture. And I have that right here. So as we said, there's many other variations. There are some exceptions to the rule, but we only want to focus on these 3 examples here. So US to I, UM to A adding an E at the end. So there should be some other examples here. Lamina to laminae. So again, example of that, A to AE. The UM to A, epithelium, epithelia. Septum, septa, it's a good example. And then here, US to I, bronchus, bronchi, villus, villi. So only those 3 examples. The other ones listed here, you'll become accustomed to seeing these as we move through the course. For example, here, IS to ES. When you see this later on, that's just the difference between singular and plural. So focus on the 3 that we already brought up in lecture, seen right here. And with that, that takes us through this first lab activity.